Hello everyone, I'm Dr. Lim from KB Lim Skin Clinic. This video is on non-invasive skin tightening. This is sometimes referred to as non-surgical facelift. So what does non-invasive mean? It means there is no cutting of the skin, no insertion of needles, the skin is intact, it is not penetrated. There are differences between non-invasive skin tightening and invasive skin tightening, or the traditional surgical facelift. Surgical facelift, on one hand, is good for severe laxity, including very droopy skin, turkey neck deformity, and so on, whereas non-surgical facelift are more suited for patients with mild to moderate laxity. Surgical facelift will produce a dramatic improvement, but it is associated with considerable downtime of about 2 weeks. It is expensive, it is associated with complications such as bleeding, bruising, nerve damage, infection, scarring, and sometimes unevenness of the skin. But these are usually temporary, although the downtime is significant. Surgical facelift take longer to do, takes about 2 to 5 hours. It's painful, so anesthesia is necessary, and after the post-operative period, analgesics or painkillers are also necessary. However, surgical facelift is a single procedure, and it produces a long-lasting effect which can last about 5 to 10 years. So with non-surgical facelift, as mentioned, it's good for mild to moderate laxity. The improvement is gradual because it relies on collagen regeneration, but the improvement is more natural. It doesn't produce the pullback appearance that sometimes a surgical facelift will produce, which can be quite unnatural looking. It doesn't cause much downtime, it is cheaper and very safe to do. Procedures are fast, it takes 30 minutes to 1 hour, mild or no discomfort. But because of collagen regeneration, it requires multiple treatments, and touch-up treatments are necessary. Whereas in a facelift, it will last about 5 to 10 years. Touch-up treatments are necessary for non-invasive skin tightening. So how does non-invasive skin tightening work? Essentially, they work in the same way, whether it's light energy, radio frequency, or ultrasound energy we use. It basically heats up collagen fibers in the dermis, and then the heated collagen fibers are denatured, and the skin responds by trying to heal the wound, the damage that's done. And as a result of this, new collagen is formed. This is known as neocollagenosis, and the collagen fibers remodel, and this ultimately results in improvement in skin tone, produce tightening and reduction of skin lines and wrinkles. So there are many devices for non-invasive skin tightening. The ones in yellow are described in separate videos, and I invite you to watch them, and the links are provided below. So light and laser energy can be used, radio frequency can be used, as can ultrasound energy, as in high intensity focused ultrasound or HIFU. These are described in separate videos. So this slide shows you the penetration of the different methods. IPL, intense pulse light, superficial dermis, broadband infrared or skin tight treatment from Cyton goes deeper in the skin. Lasers go to different depths of the skin. Radio frequency also goes to the deep layer of the dermis, but HIFU goes even deeper. HIFU is the only non-invasive skin tightening procedure that can reach the SMAS layer. SMAS stands for superficial muscular aponeurotic system. This layer of the skin is what holds the skin up. It's a suspension for skin tissue, and when this gets lax, the skin droops. So previously, SMAS could only be accessed through the by surgery, as in a surgical facelift, but with HIFU, it is possible to reach this layer without any cutting or surgery on the skin. So HIFU can strictly be considered to be a true non-invasive skin tightening procedure, or non-invasive surgical procedure. As mentioned, collagen in the dermis is the target in all the non-invasive skin tightening procedures. Collagen accounts for 70% of the weight of the dermis. It is what provides our skin with strength and support with the help of elastic tissue, which returns the skin after it's been pulled or tugged. The collagen content of dermis decreases by about 1% every year throughout adult life. So we lose collagen at the moment we reach adult life. And you can see on the left what collagen looks like, and on the right collagen, you can see from the illustration that collagen, young collagen, looks better and is able to do its job better. So in addition to the collagen, I just like to mention the 3Ds of facial aging that plastic surgeons and dermatologists, cosmetic and aesthetic doctors talk about. The 3Ds, the first D refers to deflation, which is loss of volume. The second D refers to descent, sagging of the facial tissue. And the third D refers to degeneration of the skin, giving rise to rough textured skin, age warts, and also resulting in a sallow, unhealthy complexion. So facial aging is a very complex procedure. We mentioned all the effects on the skin, but it's more than that. It affects not just the skin, it also affects the underlying fat, and below that the muscle and bone. So all these actually get smaller, and with the decrease in deep support to the skin, it is like we're wearing oversized clothes, and the skin begins to drape, as will oversized clothes as well. So with facial aging, I like to summarize: there is degradation of elastic and collagen fibers, there is loss of fat, and also redistribution of fat, so it droops and it falls lower into the face, causing jowling and changing the contour, the sharp contour of the neck and of the jawline. It also results in loss of muscle tissue and the facial bone structure as well. So many areas are impacted by the aging process. Very importantly, when we talk about improving the appearance of the skin, we also focus on the balance of facial proportions. So the attractive face is considered as a face that has equality between the horizontal thirds and the vertical fifths. So what are these? So with horizontal thirds, we are referring to the thirds that are on the face as illustrated here. From the hairline to the area between the eyebrow, that's the first third, and then from the eyebrow to the base of the nose, the second third, and from the base of the nose to the chin, the first third. So perfect proportion would be 1/3, 1/3, 1/3. Now, not all of us are born with perfect proportions, but it helps to improve proportions as well as to improve the texture and the firmness and the tightness of skin. Improving the facial proportions will also give us a better overall result and an improvement in facial appearance. So in addition to that, we have the vertical fifths between the inside corners of the eye, the width of the eye, and from the lateral or the side, the outer corner of the eye to the rim of the ears. They should all be 1/5, 1/5, 1/5, and 1/5. As mentioned, not all of us are fortunate enough to have this, but it helps to improve some of these proportions to try and achieve the golden proportions that everyone so desires. So in addition to treating the skin, improving equality, also improving the proportion, bringing it nearer to the perfect proportions is useful. As for the which individuals are suitable, it really depends. Whenever anyone feels that they are seeing signs of aging, they can actually opt for non-invasive skin tightening. And because it has no downtime, it can be considered. Even with minor signs of aging, it might be worth considering, because there's no downtime, the cost is lower, and there are no complications. So this is good for people with mild to moderate skin laxity. Now, we mentioned about the devices used for non-invasive skin tightening. As mentioned, we could use laser and light treatment, radio frequency, ultrasound. And the ones that are marked with a red asterisk asterisk says discussed in a separate video, and as mentioned, you can find the links in the description below, and I invite you to watch them. They can also be seen on our website, which I'll mention later on. Now, after doing all these non-invasive skin tightening procedures, it is important to know that after achieving the results that we want, we must also try to maintain a healthy lifestyle, and this means taking a balanced diet, exercising regularly, avoiding smoking, reducing alcohol intake, reducing stress, and protecting against sun exposure and pollutants is important and will help us maintain the improvements that we have achieved with all these non-invasive skin tightening procedures. So as mentioned, please go to my website at www.kbilimskinclinic.com, where you can view videos and also read about the common skin conditions such as acne, eczema, psoriasis, and various other skin conditions. So I hope you found this video useful. I would like to thank you for watching and hope to see you again. Goodbye.